based on your experiences going to the dentist, what do you think a dentist does? I'm obviously going to tell you, the what a dentist does from the perspective of the American Dental Association, but I want to hear from you. What do you think they do? Okay, so I'm seeing a couple of answers there. They work with teeth. They get involved with teeth health. Okay, wonderful. Anyone else? Okay, wonderful. So yes, dentists do work with teeth, but what you're going to learn today too is that they also work with more than teeth, right? Dental health is part of your oral health, and someone did say public education and on sanitation. So I think yes, on maintaining good oral health. So let me go over the presentation here. So what do dentists do? Based on the American Dental Association, dentists diagnose and treat diseases, injuries, and malformations of the teeth, the mouth. Dentists work with your anywhere from your head and your neck, right? They also educate patients on how to take better care of their teeth and prevent oral diseases. They help a patient to improve their appearance. In one of the previous slides, you all were asked, what actors, actresses, famous person, who do you think has a nice smile? And you all typed in some great answers. So also, dentists do perform surgical procedures such as implants, tissue grafts, and extractions. They also do research. We have researchers at the college trying to regenerate teeth. Currently, if you lose a tooth, that's it. It's gone. You can never get it back, right? With stem cell research, they're trying to be able to regenerate teeth. Next slide, please. So right now you're in high school, and if you may be interested in going to dental school, we're going to tell you a little bit about what things you can be doing now in high school. And you may have heard some of these things in your other presentations, so I'll just go through it really quickly. You all know that you need to do well in high school, right? You need to take a lot of courses, math, science, writing. All of those courses are going to help you when you transition to college. And I did see in the chat that one of the students got accepted to UIC. Congratulations, that's great news. That's early admissions because I know it's not even Thanksgiving, and so that's awesome. Take honors college courses and advanced placement courses. And I know you're thinking, oh my God, that's a lot of work. Yes, it is. But if you do the hard work now, that's going to help you when you're going to college, down the road. Do well, get good grades, build a strong GPA, get ready for those standardized tests, which I'm sure you all have heard about, on and on and on and on. The ACT, the SAT, it's a lot of work, but you can get started even as a sophomore in high school. Get to know your teachers, get to know your counselors. I know with this virtual world, that's a little bit difficult too, right? Because we're not at the school. You can't just go to the counseling office and just stop by and say hi, but still make it a point to connect with them. They're really going to be able to support you and guide you. Do visit your counselor at least once per semester. And you're already doing some of these things that I'm recommending, because we recommend that you get engaged with academic enrichment programs, college visits, and you're already doing some of that. Next slide, please, Dan. Okay. So a little bit more of what I've already mentioned. Work on your time management skills. In Zoom, there is a function where you can raise your hand. So how many procrastinators do we have in the room here? Don't be shy. I'm not going to judge you. I'm not going to judge you. Okay, so I see people raising their hand. Okay, so good time management skills are important, right? Your study habits are important. Your test taking skills, we talked about that a little bit already. And then your written and your verbal communication skills are super, super important, especially if you're going to get an internship or a job, or even if you're going to go on to college, right? So next slide, please. So start building your resume. It's not too early for you to start in high school, because some of you may be thinking, I'm in high school, I have time. Well, take advantage of the time now, because time is going to fly. There are some dental students that I have worked with, and some of them actually got interested in dentistry when they were in high school. They were looking for a job, they got a dental assistant job, and for you to be a dental assistant, you don't need any formal training. If a dentist hires you, they can train you. Okay, so that is a job that you could possibly get in high school. You can also shadow a dentist. So do get involved with extracurricular activities at school and out of school, such as what you're doing now. Volunteer in your community, and you're already engaged in academic enrichment programs, so you're doing great. Thumbs up for you. Next slide, please. So with dentistry, I'll tell you a little bit about the path to dentistry. And Saul is a third-year dental student at the college. You'll meet him in a little bit. So you obviously are in high school now, right? And then you have to go to college. After you go to college, then you have to apply to dental school. Dental school is 4 years. And the interesting thing with dentistry is that you do not have to complete a residency. We'll tell you a little bit more about residency programs and what that means. But some of you may have already visited a specialist who specialized in orthodontics. A lot of students your age got braces, and so that is a specialty of dentistry, okay? So next slide. In college, you don't have to major in pre-dentistry. There actually is not a pre-dentistry major. You can major in anything. You can major in music, English, as long as you take the dentistry prerequisites. And that's the biology, the chemistry, and the physics. There is more standardized testing for dental school, and that's the dental admissions test. Also, we do encourage you to find a trusted mentor and join a pre-health organization in college. And just like you're doing in high school, in college, the students still have to volunteer. Some students start shadowing a dentist in college, and that's how they become interested in dentistry. Next slide. Dental school. Like I said, we have a third-year dental student with us today, but really briefly, I'll tell you what dental school involves. Dental school is 4 years after college. The first 2 years, students are taking a lot of biomedical science courses. So anatomy, histology, physiology, immunology, genetics, embryology, neuroanatomy. They're practicing in dentistry. They do practice with their hand skills. And that's what Saul is going to teach you in a little bit. And then eventually they start seeing patients in the 3rd year and 4th year of dental school. And as I told you already, you don't have to specialize, but if you do choose to specialize, there is a range of specialty programs, and those specialty programs actually are in duration, can go anywhere from 2 to 6 years. So we have pediatric dentistry. So you probably have seen a pediatric dentist, orthodontist, periodontist, endodontist, oral surgeon, and if I didn't say prosthodontics, that's another one. So next slide.
Right, so if you guys have any other questions, just send them through the chat or feel free to unmute yourselves. Also, we have a very, very special guest in our audience, Dr. Pendleton. He is the director at the College of Dentistry at the Urban Health Program. So Dr. P, if you can hear us, feel free to say hi to the students. If not, that's perfectly fine. But I just wanted to make sure that everyone knew that Dr. P is in the call.
Well, hello, everyone. It's good to see everyone and to be here this evening. This is my favorite night in the whole semester for the Urban Health Club, the College of Dentistry. I'm not going to take up too much more of your time because I know Moses has a lot to say, but I was really impressed by Jennifer's answers. Jennifer has been doing her homework, I can tell, and that's really impressive. So hello, everyone. If you're interested in dentistry as a career, you're in the right place. Braulio Espinosa, and even Jennifer Contreras, who's going through the process now as a pre-dental student, are excellent resources. Natalia can point you in their direction. So if you're interested in dentistry as a career, there are individuals here who can help you along the way. So enjoy the rest of your evening, and it was just great to see everyone.
Thank you, Dr. Pendleton.
Okay, so I will again introduce Saul, and I'll let him tell you a little bit about his background, where he's from, where he grew up, where he went to high school, college, his major, and then we'll go from there. Saul?
Hi, can you hear me? I'm in one of the labs at UIC, so it might be a little loud. You might hear some noise, so let me know if it gets a little too loud. But I'm was born and raised in Chicago. I grew up in Little Village by 26th Street, if you guys are familiar with that area. Moved to Cicero, and I saw someone in the chat say they went to Morton East High School. I live like 2 blocks away from Morton East High School, so I went to Morton High School also. Went to UIC, majored in biology, and now I'm a 3rd-year dental student here at UIC.
And Saul, were you always interested in dentistry? And and also, when did you become interested in dentistry?
So it was actually my brother that got me interested in dentistry. One of the first times I went to a dentist's office, I think I was like 8 years old, and my brother's maybe 10 or 11. And he was really surprised when he saw a doctor who had a Hispanic last name. And he just never saw a doctor or a dentist that was Hispanic, that was Mexican. And so he kind of got inspired by that. And he talked about it all the way on the ride home. And I never really thought about it. It never really hit me until I got a little older, and I realized how important it is to have, someone of my nationality, Hispanic and Mexican, in the position of a doctor. And he encouraged me in high school. He encouraged me in college to become a dentist. And I shadowed, and I assisted, and I loved it. And yeah.
So we have a question in chat asking, how do you know which toothpaste is the best and how is it made?
I don't know how it's made, but as long as the toothpaste has some fluoride, that's always a good start. And a lot of toothpastes will have an ADA seal of approval, and you can go by that too.
Remember, everybody, this is time to ask questions. You can ask more as we're going along, but this is dedicated to questions.
Like, you can ask anything you want about teeth, dentistry, about anything.
Dental hygiene, whatever.
Don't be shy. No question is a bad question. They're all great.
And if you're a little bit nervous about talking, you can just type it up in chat. We'll read it out for you. Yeah. Does your high school GPA matter a lot?
I can answer that. High school is tough. And I would have to say that as long as you can get into college, and as long as you do well in college, for dental school, that's what matters. We don't look at your high school information. So it's important now to get into college, but once you're in college, no one's going to look at your high school. There are more questions then. I'll let you take over.
We got, what school is the best for dental?
So I think Saul and I are biased.
Yeah.
UIC is the best.
I mean, what I always was taught was, at least for college-wise, you're going to learn the same thing at each school. It's just a matter of having a name to go with it. So, I mean, that's up to you. Whatever works best for you. You'd have to look into the way that the schools break down. How are classes in dental school?
Yeah, classes in dental school are definitely tough. You're going to spend a lot of time outside of the classroom studying. But it's kind of a good thing because you build the relationships that way with your classmates. You form study groups, and you guys get together at the library or each other's apartments and study the material. But it's definitely tough. It's a lot of work, but it's rewarding once you start getting into the clinical aspects of dental school. It kind of makes it worthwhile.
Did you do any dental assisting?
I did some shadowing and assisting for a couple of years. Yes, I did.
Okay. Is it a lot of money?
Are they asking for tuition or are they asking what the dentist makes after?
Well, we could just talk about both.
Yeah, we
I
can
mean,
talk about both.
we got time.
Okay.
Yeah.
So, okay, Jennifer said
Yeah,
both.
both. Yeah.
So, dental school is, it is, I'm not gonna lie, it is expensive. But what we do tell students is that it is a commitment, because you're gonna be a doctor of dental medicine. So many students, when they think, I wanna be a doctor, they typically think a physician. But being a dentist, you're also a doctor, you're also treating people. And when you do graduate, our students are able to find good paying jobs to be able to pay back the loans, because they do have to borrow loan money to cover the expenses. Saul, if you want to mention something
Yeah,
regarding that.
yeah. I do know some students who graduated and are now working as a dentist. And my brother's actually a dentist. He graduated a couple years ago. I can say that you make very, 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 very good money as a dentist, and a lot of it comes down to your work ethic, how much you kind of learn in dental school, and how comfortable you feel with certain procedures when you graduate. But you can definitely make really good money when you graduate.
Jennifer Plasencia said graduate school in general is very expensive, but as Jennifer C said, it's an investment for your future. Then we got another question. How would you suggest we encourage friends and family to visit the dentist when they are scared? I think that's a good question.
Yeah, I think some people are dental phobic, where they're afraid and nervous to visit the dentist. So it's really important that if you have a good relationship with your dentist, that you encourage your friends and family who are a little nervous and have some anxiety to visit them, because you trust them. You can tell them, kind of vouch for the dentist. And I think a lot of it comes down to building relationships with the patients and being patient with the patients. But it's definitely a challenge that I know some dentists face, as far as patients who are anxious and scared to visit.
And if I can mention something that Saul brought up earlier, it was in regards to visiting a doctor, a dentist that speaks your language, in this case, Spanish, and that can understand you and you can communicate with them. I think that also makes a difference in how the patient feels and is receptive to the advice that the doctor is giving. So I think that's why it's important, obviously, to diversify the dental field. There's another question.
Yeah, we got one more question. How do you guys feel about the stigma of what doctor means? Meaning that a lot of people say a doctor is someone in a hospital setting. And I was wondering, how does that make you guys feel?
Personally, it doesn't really like affect me. I mean, doctor is just a title. I didn't come into dentistry to become a doctor just by title. I wanted to help people and have interactions with people and help my patients get through, either with their pain or other issues going on. So it doesn't really affect me too much, but I'm in it more for the work than for the title. That's kind of how I see it.
All right. How has being in dental school changed your own hygiene habits?
I'm definitely a lot more subconscious and a lot more aware of flossing and brushing. I take my time now, and I floss every night now. Before I didn't, but it's definitely opened my eyes up to dental hygiene, how important it is.
If the students have any more questions, we do have a third-year dental student, Moses Raspberry, who can answer your questions. Moses, if you can hear me, the students were asking, do dental students get scared of possibly, I guess, performing a bad procedure and on accident? I think someone said messing up people's teeth. Obviously, I know you work very hard, and I was telling them about the training that you all receive, but I think it'd be great if they can hear from you.
Absolutely. Like Brian said, I'm a third year dental student. You have to excuse my speech right now. I have braces in, so I'm getting used to that right now. Congrats to everyone. Hello, everyone. All of that good stuff. If you're considering dentistry as a path, that's awesome. Now to get to the question, do we get scared about messing up someone's teeth or something in that sense? Absolutely. The scare is always there. Like it is. However, you have to be kind to yourself, be patient. and mistakes will happen, right? But I think that if you take your time and you really try to uh, be prepared for the patient when they come in, and really do a thorough background and have a clear um, understanding of what the treatment is for the day, uh, that can minimize and possibly um, get rid of some of that anxiety or that fear of making such a mistake. So that's what I try to do. I look at what I have on my agenda for the week, as far as patients go, and I kind of, if it's a treatment that I haven't done in the past, I definitely look over some of my material and try to get prepared as possible. Talk to faculty, get some different feedback on how they would probably tackle the treatment plan and things like that. But that's a really good question.
Tell us about yourself. You did not, I mean, we introduced you as a third year dental student, but you didn't tell us where you grew up, where you went to high school, to
What's your
college, all
favorite
that other good
movie?
stuff.
Oh, my favorite movie. Okay, and we're going to talk about Walton. No, what made me want to be a dentist? Great question. The creativity and the science piece. I grew up in Chicago. I attended Percy Julian on the south side of Chicago, which was probably not the best school, but it definitely got me to where I am today. I attended U of I down in Champaign, which is a sister school of UIC. I majored in community health, which is non-traditional for most dental students because I was pre-physical therapy. I had a change of heart. That's a long story. I got my master's in public health. I was working down at U of I as a academic skills specialist. So I was working with students there to basically help them find where they wanted to be in life as far as a career. My locks I've had for 10 years plus, something like that. I don't know. And then dentistry, my fiance, she's actually a dentist. So I got introduced to dentistry and I thought it was really cool. I shadowed, volunteered. I was in a lab a little bit here and there. And I met Braulio, the key to dental school.
Also, if you guys would like, to see him better, if you can find him, hit the three dots at the top and just click on pin. So, yeah, just FYI.
I can't read the rest of the question. Did you want to become a dentist? What's the question? What is it?
Did you want to become a dentist? Yeah.
Well, yeah. Not to be, yes, I wanted to become a dentist. I think that I knew very little about the field. So when I was introduced to the field and I learned all of the different procedures that you are able to do, how you can always bring yourself into your work. I think there's very few occupations out here or career paths that you are able to bring yourself into your work. And I can have a treatment plan and someone else can have a treatment plan and they can be totally different, but no one's wrong, right? And as long as it stems from evidence-based, meaning like there's some research behind it, there are scientific studies behind it, you're good to go. So a word you guys probably know is autonomy. So that's just the ability to kind of, do what you want to do. So I appreciate that part. What's your favorite thing about being a dentist? Honestly, the lax clothes. I'm not gonna lie to you. Like being able to rub scrubs, man. I didn't want to wear a suit. No, I'm joking. Again, the best part of my favorite thing about being a dentist is just really to be able to bring my creativity to my work. My favorite procedure so far are extractions. I love to do like oral surgery. Like do flaps, sutures, pull out molars, premolars. I don't want to do incisors; they're too easy. No, I'm joking. But I just like do it. What is something you find difficult? Um, Being able to be flexible with different personalities. You might start the day with someone who's really lax and they're like, hey, whatever you come up with, whatever you feel is the best treatment plan, let's go with that. But there are also, you get another patient that have different factors that you have to take into account. financial piece always plays a part. Um, some patients don't want partial dentures or complete dentures, so you have to educate. I think that is also a really good part about dentistry is being able to educate individuals that's coming in for different work. Where's the time where you messed up during it? Okay, was there a time? No, thank God, I haven't messed up. I'm gonna put yet on that.
Yeah.
Because again, you have to. The only way you can grow is by making mistakes, right? And to be able to identify those mistakes is what's even more important. Who are the easiest patients to deal with? I really don't know. Like if you have the kids, I mean, you could be a little bit more playful and kind of play on their imagination with things. So that's pretty fun. It kind of brings that kid factor back, and that was really difficult for me to like. I was like, I don't know what's the new cartoons and things like that. So they keep me abreast on that. The old patients, I love the old patients. They're just really relaxed, chill, but they're always ready to go. Like soon as they sit down, they're like, okay, I'm ready to go. Like, and I'm like, I have you for 2 or 3 hours. Recommend
So
your dentist.
we should probably
Yeah.
pause questions right now so you can
They're
head to
not
the lab.
allowed.
And, yeah, head to the
Um,
lab.
So I'm in the lab, and this is live fire, right? Can't play around with that too much. But I'm gonna try to keep it simple. This is just like they call it like a PK tool, and what you use is this is just used to pick up your wax, and you have different carbon instruments. When you guys decide to come to dental school, I'm not gonna tell you everything because I'm trying to encourage you to come, just so you can find out exactly what it is. These are some different like carbon instruments, right? So I'm just going to show you like what a finished product will look like. And this is not like the cleanest, but it should give you some type of insight, right? So when you start dental school, you're going to learn all about the teeth anatomy and different cusp and angles and all of that stuff that doesn't matter right now. So as you can see that all these teeth are white except these two right here, right? And this is a waxed up product, and it takes some time, right? It does take some time, and I'm not gonna take up all the time. I just want to show you like how would you go about starting something like this. This is wax, so if I put the heat over it, it'll go away 100%. Okay. And so really quick, like when you start school, the point of doing the wax up and everything is just so you can learn the anatomy and where it should be. And this is going to help transfer when you guys like get fillings done, or you heard someone got a filling, or veneers, or crowns. So you want to make sure that you put in the right type of anatomy, right? And that's going to help. The waxing is going to help with that. And when you have a patient that comes in and you want to do a treatment plan and you want to see if there's enough room for a certain size tooth or anything like that, I don't know if you guys can see that. So it would be more like this in your mouth. So you see we have a tooth missing here. We also have one missing here, right? So what I would have to do is take an impression, and I would have to do a wax up for the teeth to see what that would look like, okay? So just a quick demonstration. This is not the best ideal situation, but you're going to heat up your tool. Can you see? Can you guys see? Okay. So you would heat up your tool. This is a block of wax. Okay. This is the tool that I was saying you're going to take the wax and move it from one place to another. So what I would do is start here, heat this up, put it in the block of wax. Make sure you guys can see. You want it to cool just a little bit. Heat this up. And you would start, it's a long process, but you would start building up the material. And so when I get a shell, right, I would take a larger instrument to start placing more wax. Broya? Broya?
We can see it perfectly. It looks good.
No, you can, please cut it out. Did they see the video that I did before?
No, we haven't showed it to them,
Okay. All right.
but this looks good. I mean, we could see it with detail and you're just gonna, if you can explain, I mean, you don't have to do it right now, but if you can explain that eventually you would build up the tooth.
Yes, absolutely. So, this is what it would begin, right? You see that I got a slight contact here. You call this a contact, right? And so I would keep building and I would make this just a square, right? And then I would take my carbon instrument and make my, start making the anatomy and the shape of the tooth, right? I'm trying not to like use too many like dental terms or anything like that. But what I would like to do is like flush this all the way across, right? And then you're gonna try to mimic this tooth because this is what goes here, right? So when you guys smile, what I'm working on is that front tooth that you guys see first, right? So you see this embrasure here, I would have to try to follow that. And we call that a contour, right? So we wanna make the same type of contour as this tooth to match that.
Do the students have any questions about the lab work that dental students have to do?
And it doesn't have to be necessarily this, go for it.
Right.
For somebody like
We
read
got
it to me
someone
at
that
the front of
raised
the
their
room.
hand.
I have a question. Why don't you just make a molding of the front tooth that is still there, and you just put liquid in it to make a copy of that same tooth?
So that is ideal, right? But now let's take a closer look at that. That's a good question, right? Now I can do that if I was trying to mimic this tooth, right? Because if I take a mold of this tooth and try to fit it on this tooth, it won't, the mold won't sit on this this typodont, right? Does that make sense? Because you have to make a mirror image, right? And the only way you could do that is by taking a mold of the same tooth. Now, there is a process that we can do here where you can find a model that has this tooth in there, like you're saying, but you still would have to contour it. And I didn't want to cheat you guys and just do that process and say, hey, this is how you do it, because that's not how you do it. You won't learn anything from that. You won't learn how to shape and contour the tooth. But that was a good question. See, you should become a dentist. You're already ahead of the game.
Yeah, I'm in one of the labs at UIC College of Dentistry, and this is where we do a lot of our waxings. And your first year, you'll be here a lot doing waxings. This is a waxing cassette, so you have different instruments that you use for it. This is the wax, the gray wax that we use. And now they're using this flameless heaters. And so you just kind of have an instrument and you place it in there and it warms up the instrument. And this is a tooth kind of simulating that has a cavity. You guys can see that. And so what waxing can help you do is it helps you kind of build your hand skills. It helps you learn and be comfortable with the anatomy of teeth. So you can kind of translate that to working with patients. And you're just gonna grab you're gonna heat up some of the wax. It turns on. Let it get warm. And when you have some wax on the instrument, you can see that. You're gonna warm it up again. You're just gonna place it on the tooth where the cavity is. And kind of fill in the hole. And you're gonna blend it in. It's the same thing. And once you kind of have it filled up, there might be some extra wax that you're just kind of shave down. And that kind of helps you learn like the contours of the teeth and the anatomy of the teeth. So you can use like a carving instrument. You're just gonna kind of carve that down so it's smooth with the tooth and fills the hole. and brush away the excess. And then now you're trying to fill the tooth, and it's like flush with the tooth. And it's kind of like what you would do with a tooth that has a cavity. And so you know, you kind of learn how to fill the tooth and contour it and make it look natural. And this is a different type of waxing. It's a colored wax. So there's a little more depth of the teeth. And you would do this. This is for, and then I kind of want to show an example of how you'd use it in real life. Like if a patient walks into your office and they have one of their teeth knocked out, and they have a wedding to go to, you know, in a day or two, and they want something to replace the tooth. This is something that you might see in the office where the teeth were knocked out. And you want to replace the teeth so they can go to a wedding or go to a party. And so what you would do is you would make a wax up of the teeth to look like this. So it goes, so you're trying to fill those voids in with the wax. And then you'd make this clear retainer from those waxings. And you put filling material here. And then so now they can wear this and it covers up. And so now they can go to their wedding or their party or whatever, and nobody will ever know what happened. And this is just a temporary solution, but this is kind of like where you would use waxing to build up a tooth and kind of help someone out who's worried about how they look, you know, if they need something quick for a day or two. You know. Yeah.
Nice. So do people have questions, you know, about the wax demonstration for
Is the
Saul directly?
is the wax thing a substance that you actually use to fill in cavities, or is that like is that another substance that you use for the demonstration? Like, do you use something else for the actual waxing?
So for actual patients, we use, it's called resin composite. It's like a filling material. We don't use wax. Waxing, we use it in, you know, non-patients, kind of like in, just to kind of test your hand skills, you know, kind of develop them and learn how to kind of contour around the teeth. But you do use wax a lot in the lab. So like I said, kind of make something like this. You know, this is common. You see this a lot in the dental labs. But as far as patients goes, you'll use an actual filling material, not wax.
Did you make the tooth out of wax like out of memory, or did you look at a tooth and try to?
I guess out of memory. Like you do waxing so much your first year, and you just learn a lot about tooth anatomy that you can kind of just make it from scratch.
Wow.
Yeah, that's very cool. Anybody else
Dan,
have questions?
if I can mention something, because it goes back to Rosalind's question. So in dental school, the first year and second year, Saul and all the dental students spend a lot of time in the pre-clinic that you saw. So that's a lab. And they're actually practicing on plastic teeth because they do that for 2 years. And then by the third and fourth year, they're seeing patients. So I would like to ask Saul, you started seeing patients in May, I believe, and June when we came back after, you know, the building reopened and everything. What has been your most difficult patient case that you have done so far in these months that you've been seeing patients?
So my most difficult case, I'm not sure if I can really like put this across so well, but there's a patient that had a very complicated bite. And because of that bite, there was a lot of prosthodontics that had to be done. Like some teeth would have to be extracted, implants placed, implant supported bridge, and the patient had some caries that needed to be filled. But it was a complex case where it involved prosthodontics, periodontics, it involved endodontics also, and just restorative care. It was a very complex, comprehensive patient. But I'm working on the patient now, and it's a very rewarding case because I see the patient come in and they're seeing the progress, and it makes them happy seeing the progress each visit.
Wow, thank you. Anyone else have any other questions? Saul is here to answer any questions for us, so please don't be shy and feel free to ask.
Yes. Do you see do you see patients of any age?
So yeah, we actually have a pediatric rotation. So in the pediatric rotation, we have that weekly, and we see patients as young as 6. Um, and then in the actual our home clinics, we see patients that are over 18 years old. So we see patients that are 18, 6 years old, 10 years old, 67 years old. Yeah, you see the whole age range.
Were you nervous during your first year? And if so, how did you get over it?
Yeah, I was definitely nervous, kind of feeling overwhelmed when I first started. Had a lot of it, kind of just anxious to get started, but I just took my time, just trying to take it day by day. I didn't try to rush anything. I just made sure that I tried my best whenever something came up. And eventually you kind of get your footing and you get more comfortable with what's going on and you make your friends and you kind of like have your support group. But it's better now.
Is there any specialty that you are interested in?
I'm thinking about endodontics. So that's it's root canals. Lots of root canals every day.
Can you tell people what is it that, how is it that, why we have to get a root canal?
So yeah, so root canal, a lot of people like they know what cavities are. It's like a hole in your tooth. Sometimes that hole can get deep enough where it reaches the nerve of your tooth. Every one of your teeth has a nerve in there and a pulp chamber, like a nerve. And so if the infection reaches the pulp chamber, if the cavity reaches the nerve, then the tooth, in order to save the tooth and stop causing you pain, because that will cause you a lot of pain, you need a root canal. And the root canal will stop the pain and it'll stop the infection and it will allow you to keep your tooth instead of having to get taken out.
So, talking about dental anatomy, we are going to talk about dental anatomy.
So, when I was waxing up in the lab or just getting started, can someone just like guess and think like what number that is? Or I mean, what tooth that is? So we have incisor, a premolar, canine, and a molar. Just like throw out a guess.
You could type anything in the chat. What tooth do you think he was waxing?
2.
So I have a molar, someone said. So since someone said molar, let's go over that. All right. So a molar is going to be like that big, fat, wide tooth that's in the back, right? And you're going to use that more so for I'm trying not to use the scientific words, but like mastication. So like for grinding your food, right? So those big teeth in the back, right? And so after those molars, so when you guys talk about like your wisdom teeth, and I was able to hear the conversation a little bit, is that a few of you got your wisdom teeth removed. That would be the molar, right? And so the premolar is what's next, right? So if I'm going from the posterior to the anterior, meaning from like back to forward, right? So after we have our molars, we have 3 sets of molars. So they're identified as like 1, 2, and third molar, right? So your third molar is your wisdom teeth, and that's what you use for chewing. Next, you have your premolars, right? And you have 2 sets of those. Thank you, who's ever like doing a certain thing. And as this says, it sits right behind the canines. They're going to have a little bit more of a taper than the molars. They do have like a flattened shape. Some may identify, but there's like a bow shape at the top, like on an occlusal table. And when we're talking about the occlusal table, we're talking about what you guys bite down on, right, at the top. And then you have something that's like snake eyes and Y shape at the bottom. I know that's really detailed. Don't worry about that though. But again, that's a part of like the chewing and the grinding aspect, right? So again, if we're going from posterior, we went over the molars, and then the next set is the premolars. The next set is what? The canines, right? So canines are your longest teeth in the mouth. They're sharp. Those are for tearing your food and things like that. And then our incisors, that's what I was waxing waxing up inside of the lab. And so those are often identified as your anteriors. You use those to like shear food, like just kind of like when you take a bite of an apple, that's like your first contact. Can we go to the next slide? Oh, and here's a perfect layout, right? So we went, so they're missing the third molars, which is the wisdom teeth, but due to like evolution and things like that, a lot of people are losing those wisdom teeth, and they're not even erupting at some point. So yeah, we kind of talk about that, and there is a age associated with that, with when they erupt. And can we go to the next slide? And it just kicked me off. I'm not able to see it. I'm sorry.
Oh,
It's
Well,
it's the
we have
permanent
adult
adult teeth.
Okay, yes. So this is the point, right, there you go, the third molars. So the previous slide was talking about the transition from children teeth, peds or pedo, to adult teeth. And I'm sure a majority of you, your mouth looks something like this. And this is that third molar we were talking about with the wisdom teeth. You have 3 sets of molars, then you have 2 sets of premolars. You have 1 set of canines, and then you have 2 sets of anteriors or incisors. So you have like your central and your laterals. And next slide. Wow, okay, I went through that a little bit too fast. Are there any questions that I can answer?
yeah.
Yeah, we have
mean,
about
I
like
think you
3
went through
minutes left
pretty good.
for this one, but if you guys
Yeah.
have any questions, ask them now. If not, we can move forward with dental hygiene.
Exactly why do cavities affect your teeth?
Okay, that's a really good question. I'm gonna throw it back at you. Why do you think cavities like affect your teeth?
I know that cavities create holes in your teeth, and I know that it's different levels with the gums. Like you got the deep inner level, and they say that with cavities they shouldn't reach the inner level of your gums because that can create permanent damage, I believe. And
Yes,
that's why we have premolars and stuff like that.
yes. So you're absolutely right. So cavities is it's a process of breaking down your teeth. That's caused from like plaque and sugar and bacteria build up. Um, and it's a disease. That's exactly what it is. It's a disease of that tooth in particular. So you do have different levels of uh, cavities. You have an incipient, which is like the start of the cavity. It might show up as a white spot, or it's just in the enamel portion of the teeth. And then you reach somewhere called the dental enamel junction, which is where most dentists will call actual cavity that needs to be restored. And then you have the issue with the cavity growing is that it gets to the pulp, which is like the life of the tooth, the artery, the vein, what keeps your tooth alive. So when you get into the life, the artery of the tooth, that's where the pain starts to come. That's when you need root canals and crowns, and that's a long conversation.
So,
Thank you.
so I think this is a perfect transition for the dental hygiene presentation, because you are asking great questions about cavities and how those form. And before I let Moses take over that section, I would like to also just make sure that you understand that there's a connection between your oral health, what's happening in your mouth and your teeth, and your overall health, right? Your mouth is part of your body. And so whatever happens in your mouth does affect your body. And a doctor of dental medicine, a dentist, that's the degree that they get, they're also doctors. So there are many different kinds of doctors out there. So we just want to remind you of that. They just specialize in the head and neck. And with that, I'll move into the next slide. So go ahead, Moses.
Absolutely. Your teeth are important for chewing, talking, and as someone already stated, appearance. Someone said like your smile is definitely a confidence booster. So that's for sure the truth. But did you know that problems in your mouth could create problems elsewhere in your body? It's a good question. Did you guys know that? I didn't even know that, right? So,
I did.
so let's examine what does it mean, like, far as oral health, right? Tooth decay. We kind of already discussed that, right? So plaque and sugar combined creates acid, right? And that's going to make a perfect housing um, place for bacteria, which is known as plaque. And that acid is going to erode the teeth, right? So your enamel, it plays as a shield, that hard protective covering, right? And that's the hardest substance in our body. Unfortunately, we are not at a point where we can recreate that enamel, right? And the dentin that someone was just talking about is, like they were saying, different layers. The dentin comes after the enamel that you can see in this little picture. And again, the pulp, like we said earlier, is basically like the life of the tooth that provides the blood and the nerves and all of that good stuff for your teeth to survive. I guess I know a little something, right? I know what I'm talking about a little bit. So the acid that is produced from the bacteria in the plaque, you know, like I kind of hinted at, is that it's not about how much sugar you eat, it's how frequent you eat sugar, right? So if you don't have a great oral hygiene basis, meaning brushing your teeth twice a day for 2 minutes a day, with a floss once a day, then you create a plaque buildup, and that acid is able to eat at your enamel. And if you keep eating sugar, then you're feeding that bacteria, you're feeding that acid to get, like my guy looks at the end, right? Acid plus tooth enamel equals tooth decay. So diet and nutrition, junk food. Really quick, what's you guys' favorite junk food? Let me just get like a few of them.
Shake Shack.
Mom's lasagna.
Mom's lasagna. Can I get one more?
Cotton candy.
Cotton candy. I like cotton candy as well. So let's go with cotton candy. So all foods are a part of your diet. When someone says they're going on a diet, you have to specify. That doesn't mean anything. Whatever you eat, you are on a diet, because that's whatever you eat. But we all know that there's benefits to eating apples, but what's the benefit to eating like cotton candy? Apples are also high in sugar, but they are natural sugar, and the abrasiveness of an apple and different fruits, they can remove some of that bacteria. As far as something like cotton candy that's soft and it gets all sugary and it just sits and sticks, now you're creating a house for bacteria and everything like that. Snacking between meals is not the best thing. You want to reduce that as much as you can, right? Again, it's not how much sugar you eat, but how often, right? Um, Good meals, it definitely provides growth for muscles and for you young people to continue growing. It provides energy depending on what you're eating. And of course, you have to have a good balanced diet to be able to focus. I'm trying to tell you, I got to live by it. I got to have a good diet to even focus on what I'm doing throughout the day. And of course, it builds healthy skin, bones, and teeth. Soft drinks, soda, as we all know in Chicago, pop. You see the first thing it says, soda drinking. Frequent soda drinking causes decay when sugar and acid combine. So we keep hitting on the same concept of frequency of sugar with the acid and enamel. So each sip causes 20 minutes of acid attack that may cause tooth decay. So if we just have one can of pop or whatever, and that's just 20 minutes that one day, versus if you have 5, right? That's over an hour, right? Of constant decay, right? So what are the results of tooth decay? Pain and infection, difficulty with speaking, difficulty with chewing, because that decay has gotten down to the pulp and you have inflammation and pain and you don't chew on that side. Difficulty concentrating. Some people say tooth pain is some of the worst pain they've ever experienced. Loss of self-esteem. To that person who said that smiling is a confidence booster. Lost in school days. I mean, if you got teeth pain, you don't want to come to school, right? Poor nutrition because you can't eat the right things, right? And of course, the number one thing, cost of care. I cannot tell you how expensive dentistry is. The cheapest thing that you can do, or the most inexpensive thing you can do, is keep a toothbrush and toothpaste and floss. All right, that's like what, $5 to $7. All right. Besides, tooth decay, harmful habits or activities can damage your teeth. Keep foreign objects out of your mouth. So for those individuals who like to chew on pens and pencils and things like that, don't use your teeth to open up bags of, I don't know, potato chips or whatever comes in the mail. You know, you guys ripping that plastic off. Biting your nails, cut it out. All right. Cracking nuts, no. Crunching ice, I'm telling you, that right there is really, really bad. That's cold, it's crunching down, that's really abrasive against the teeth. And opening bottles or hairpins, I don't know about that one either. Okay.
So we got like 3 minutes left. I don't know how that fits into being able to get everything, but
Sports, always wear a mouth guard. They do not clean the teeth. You got to protect them. It keeps the teeth wet, keeps it nice and housed, and keep them stabilized. All right. Smoking. Are we really still doing that? Really? Okay. We can talk about it. Let's go. We all know that tobacco is harmful. I think that's self-explanatory. And you can see that's what you get when you smoke, is that stain. And we're talking about plaque buildup. That's number one cause. Bad breath. Who wants it, right? Mouth sores, definitely going to happen. Gum disease. You will definitely have a deep cleaning that is not fun, okay? And possibly loss of teeth and a greater chance for cancer. Smokeless tobacco causes, right, they are doing e-cigs. I forgot about that. So teeth abrasion, gum recession. So when you get in that smile, you have those different gum levels. That's not too pleasing. Discoloration, bad breath, addiction, and of course, oral cancer. If you get a chance, just like Google that, smokeless tobacco and oral cancer. Piercings, tongue piercing. So what happens with that is that's causing like clinking around the teeth. You can get chipped teeth. I'm sorry, the ortho is really knocking me out. Chipped or cracked teeth, abscess or cyst. So that's an infection that has to be drained and cleaned out. And you can also have an allergic reaction due to cheap metal. Even some of those like, what they call like stainless bio steel or something like that can still have some adverse reactions. Increased risk of hepatitis, tetanus, and HIV due to open opportunity, right? Next. Eating disorders. It's perceived as looking good, I guess, depending on who you ask, but you do have like erosion, self-destruction, depression, withdrawal, malnutrition, and health and dental problems. Exactly, right? And death that's a long shot, but it does happen. Methamphetamine, so meth mouth, that down at the bottom. For those who drink Mountain Dew, your mouth will end up looking like this. I guarantee it, right? It's not a good look, right? So when you get a chance, look up Mountain Dew mouth, and it looks just like that. Let's go.
So yeah, so you want to brush your teeth at least twice a day. You know, in the morning, at night, ideally after you eat, each time after you eat. But when you do brush, you want to brush for 2 minutes, and you want to spend some time. You know, 2 to 3 teeth at a time. You want to gently brush. You don't have to put too much force into it. If you put a lot of force, that can cause damage to your gums, and that could even wear away at your teeth. So just be careful when you're brushing. You want to brush at a 45-degree angle toward your gum line, and that kind of helps get some of the food that's stuck between your tooth and your gums. And you don't want to forget to brush your tongue, because that's a big cause for bad breath, is the food and the bacteria that's on your tongue. And then as far as flossing goes, you want to try to floss at least once a day, and you're gonna get a large piece, about 18 inches. You wrap it around your fingers, but don't wrap it too tight. And you want to leave an inch or two of floss between your hands, and then you want to gently pull the floss between the contacts of your teeth, and you want to move up and down on each tooth surface about 4 to 5 times. And then you want to go below the gum line, and that's really important. You want to get that food that's under your gums, and then when you pull it out, you wrap your fingers around, and you get a new clean piece for the next tooth.
Okay, thank you, Saul. I think some
So we got a
questions.
few questions, yeah.
Yeah, go
Um,
ahead.
Off of the brushing the teeth section, we have, do you recommend manual or electric brushes? And on top of that, I guess there's a Quip brand of toothbrush that has some pulse technology or whatever. So I guess just talk about if that's good or bad and which one you'd recommend.
So there have been studies, and we learn about these studies at school, and they say that both electric and manual toothbrushes are equally effective. The important part is that that you brush your teeth twice a day and you do it for 2 minutes, and whether you have a manual or electric, you'll get the same results. Some people, they may be better suited to have an electric toothbrush if they have, you know, it's easier to use electric toothbrush because it's less to think about, and that's an issue with some patients like compliance. But they both work equally well.
We also had a question about tongue or mouth piercings. I forget what's the last thing that you said in that section, but they were referring to that in that was that why when they have a piercing in their mouth it smells like metal. So I don't know if you want to explain how that works exactly.
Well, if it's a metal, you're always going to have a little bit of erosion of the metal, so you might get that taste or that smell, especially when you're eating acidic foods. That can kind of wear into the metal, if that's what they mean.
Okay.
Yeah, wait, Daniel.
Yeah.
Yeah, I put that question because I remember a significant memory of it was in grade school and my teacher, she had a tongue piercing and she was like bending down to talk to me because I had a question or something and I smelled it. I'm like, it just smelled not
It
great.
stank.
It just didn't smell great to me, so that's why I asked that question.
Yeah, that's a concern you're going to have for sure when you have a piercing. Yeah.
Yeah. We have is water flossing good?
So, I mean, water flossing is better than not flossing at all, but the school still recommends you actually use floss, and they recommend that over water flossing.
Okay. What is the most common tooth pathology?
I'm going to, so, I mean, it would have to be cavities.
Okay.
That's cavity.
All right. And then when do wisdom teeth need to be taken out?
So that's a debate right now. Some oral surgeons would have them take them out as soon as possible when the patient's maybe 17, 16 years old, but other dentists and other oral surgeons would, if they're not bothering them, to leave them in. So it's kind of being debated right now. There's not a for sure criteria, so it kind of just depends on each oral surgeon or each dentist's philosophy on the subject.
All right. Do people have more questions? Because we got time.
I have a question about mouthwash. So when you go to the grocery store or Target or whatever, you see all sorts of different varieties of mouthwash, some with alcohol, some without alcohol, some with a bunch of fancy ingredients. Does any of this matter?
Generally, no. Generally, they're all the same. Generally, that's more of a marketing issue. We actually had a lab where the periodontist faculty brought in different mouthwashes, and we tested each one, and they explained to us the ingredients in the mouthwash, and some of them were exactly the same, just had different names. And they're just telling us that mouthwash is just a lot about marketing. There could be some differences, like if a mouthwash does have fluoride, that could help against cavities, but most mouthwashes are just for like bad breath and reducing bacteria. So it depends, but most of them are very, very, very similar.
Okay, cool. Um, do you know of the existence of a brown Listerine?
Yes. There's also, I think, the gold one.
They have a
And
gold one?
yeah, I think the brown one had like 40% alcohol or something in it.
Oh wow.
Yeah, that was one that they had back in the day.
Yikes. Opinions on the TheraBreath?
I'm not sure what that is.
Okay. Should you use mouthwash before or after brushing your teeth and flossing?
So again, this is one of those things that people kind of have different philosophies on it. I kind of like the idea of brushing my teeth and then using mouthwash after, kind of like get all the plaque and food out of my gums, and then have the mouthwash kind of get in those places.
Okay. Then we have, do you recommend the use of mouthwash or is water good enough? And then a secondary comment, also be careful with their breath. I had a nasty reaction to it. So I don't know what that is, but
Maybe
like
they can unmute themselves and tell us
I think
what their,
TheraBreath is a certain brand of mouthwash. I think like that's been like popular. So
Yeah, it's new, and I'm the one that had the nasty reaction to it. Like, just be careful because I had all these like weird, painless red ulcers all in my mouth, and I was like, I'm never gonna use this thing again. So
is mouthwash better than water?
I like to use mouthwash. It freshens up your breath and it helps lower the bacteria in your mouth. So I like to use mouthwash.
You heard it here first, folks.
I have a question. Oh, sorry.
I was just going to comment that I've heard also, and Saul could probably just confirm, but I've heard dentists say that, for example, if you're at the office or just out somewhere and you ate and you can't really brush your teeth right away, that you could just kind of wash out with water, and that'll help out take some of that food excess out, and that'll help you.
Yeah, you're exactly right. If you're out somewhere, if you can't brush, then just rinsing out with water can help get the food out, especially if you eat something acidic or drink something acidic. It's nice to kind of rinse your mouth with water to bring the acidity levels lower. So, your teeth are less of attacked by the acid.
We have a question from Natalia. What about gum? And then Chibuso right after, is sugar-free gum beneficial to oral health?
So we actually had a lecture about this, and sugar-free gum. Most of the dentists that I talked to recommend it because when you're eating foods, that again, it's like the acidity level in your mouth goes. Your mouth becomes high acidity, and so it leads to like your teeth being more like softer for like attacked by the bacteria, so like caries and erosion. But when you chew gum, your body releases saliva, and your saliva has a protective kind of factor to your teeth. There's buffers in your saliva, and that kind of helps with acidity levels. And there's also ions in your saliva that help kind of build the enamel back up. So I.
Cool. Can dentists prescribe antibiotics for preventing possible infections introduced via dental work?
Yes, that's done pretty often. Like for the case with the patient with the heart transplant, a lot of dental offices keep antibiotics in their office for that case. Where if a patient's immunocompromised or had a heart transplant or heart valve transplant, then the dentist can prescribe or give the patient it thinks about 2,000 milligrams of amoxicillin 1 hour before their visit. So that's done pretty often.
And then what alcohol ingredient in mouthwash partially due to the teeth? Do you wanna get on mic?
Sorry, I went like, what does alcohol particularly do to the teeth, in mouthwash? Because everything is like 40% blah 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 percent alcohol. Like, what does alcohol do to like the teeth?
So you don't really need alcohol in your mouthwash. Mouthwash that are non-alcohol based are perfectly fine. They work just as well. Some people like the feeling of that burning sensation. Again, this comes to marketing, where different patients have different preferences, and some people like that burning sensation and it makes them feel like their mouth is so much cleaner because of it. But if you use non-alcoholic mouthwash, that's fine. And we actually recommend that for people who have maybe substance abuse problems, people who are recovering alcoholics. We will let them know, don't use mouthwash with alcohol. Use non-alcohol mouthwash. That way, because it's alcohol and digestion starts in your mouth. So if you're using alcohol mouthwash, you kind of can get that in your system. And so for people who are alcoholics, that can be an issue.
And then we have, can you practice dentistry in developing countries? Is there more of a need outside of the US?
So you can definitely practice dentistry outside the US. Actually, UIC, the school has extramural rotations where you can travel to places like Guatemala or some places in Africa and help local areas provide some dental treatment. So you can actually do that at UIC.
Cool. And then we have, what effect does drinking alcohol have on oral health?
So it could dry your mouth. That's a big one. And then having dry mouth can lead to your teeth being more prone to caries and cavities. And it's one thing that we learned about is when people get intoxicated, they can trip and fall, and it leads to a lot of teeth being chipped off.